Good morning. I'm Dr. Laurel Mark. I'm an internist in Madison, Wisconsin, and a member of the Wisconsin Physicians for a National Health Program, PNHP, a professional organization doing education, research, and advocacy for universal health care and single payer. And I'm here today with Dr. Robert Kraig, who is the Executive Director of Citizen Action of Wisconsin, which is a social action group as well, and who is an expert in healthcare policy, both on a state and national level. And we're going to talk today about the impending changes from that come from our last election, in which we will be transitioning, apparently, from a time of Obamacare to something new, and the challenges in the impending repeal of the ACA, changes in Medicare and Medicaid.
Great to be with you, Laurel.
Thank you so much. So could you start by just explaining where we're at today and what you see as the changes that we are likely to face coming in the near future?
We may see action very quickly, and so we're going to need a lot of people to take action. What we're facing right now is 30 million people losing their health care, and in Wisconsin, the number is 431,000. According to the Center for Budget and Policy Priorities, that's the Urban Institute that came up with the 30 million estimate for the whole country. And so let me just give a little historical perspective so people can put the whole system in perspective. After World War II, the United States was one of the only advanced industrial countries that did not create a national healthcare system. And we created an employer-based system where if you had a good job, health insurance became part of it. And the union movement, which was very strong at that time, the collective bargaining expanded healthcare very dramatically, and even non-union employers tended to adopt it to try to compete. And it's been successful to the extent that 156 million people today have insurance through their job. And so the system's been under pressure because of cost, which I'll get to, but it still covers a lot of people. So if we want to think of a stool, that's the first leg of the stool. But of course, a one-legged stool is unstable, and so people quickly realized in the 40s and late 40s, early in the 50s, and the early 60s that there were people left out. So seniors don't have employment anymore, most of them. They've retired, and they're expensive, so the insurance companies don't want to give them coverage or want to charge very high rates. And so only a quarter of seniors back before Medicare had coverage. And so two things were done under President Johnson and the Great Society. There was two new legs to the stool: Medicare for seniors, and Medicaid, which was a partnership between states and the federal government for very low-income people. And that didn't start out covering that many people, but both were expanded over the decades. And so it currently, just to give you perspective, I told you 156 million are the employer-based system where they get it from work. But there are, in terms of Medicare and Medicaid, there are 54 million people in Medicare who are covered and as a single payer program where the government is the payer through private hospitals, etc. And then 73 million people are covered by Medicaid right now for low-income people. And so even though that was great, it was still a three-legged stool, which is still not the most stable of stools. And so what all the Affordable Care Act was, to put it in perspective, is it tried to deal with everyone left out of the system currently. And so it did not try to do sweeping reform of the whole system, despite contra the rhetoric against it by conservatives. And in fact, it tried to leave the current system in place and then to repair the parts that weren't working, which is what made it complicated. But what it did was, it expanded Medicaid dramatically, though the Supreme Court tried to interfere with that, so that everyone under a certain income level was covered by Medicaid and got insurance, and the assumption was people at that income level couldn't afford any premiums or copays or deductibles. And then it created a new marketplace called the Affordable Care Act Marketplace that was regulated and prevented insurance companies from denying coverage based on pre-existing conditions, required the plans have certain standards, cover all necessary medical care. And on top of that, it created large subsidies for people to be able to afford the premiums. In fact, most people on the Affordable Care Act exchanges, as they're also called, actually pay less than $100 a month, and many of them pay a lot less than that in premiums because it's based on income. And so there was a massive investment in making these plans affordable. Now, the problem is that despite that investment, because health insurance and health care is so expensive in this country, much more expensive than anywhere else, it still wasn't enough to make it affordable for a lot of people. And so it is absolutely right that the co-pays and the deductibles were still too high. And so it was a wobbly fourth leg. Now, in the current debate we're having, right, there's an assumption that that somehow the Affordable Care Act caused cost to increase. That's not the case at all. They were rapidly increasing throughout the whole period, and they just didn't do enough about the costs, and they didn't cause any cost increases. And the only thing that could possibly bring down costs is us doing more major kinds of reforms that would restructure the system. And so what's happening right now is what we need to, I think, keep track of is that as we need to prevent a totally immoral act, that is throwing 30 million people off their health care, because most people think everyone ought to have somewhere to go get affordable health care no matter what. When we're thinking about that, we also should be thinking about not just defending the status quo, because the public is dissatisfied with the status quo. We need to be talking about the kind of system we need to build. And ultimately, the only entity that's going to care, the only group that's going to care about guaranteeing health care for all is our own democracy through our democratic government. We should be building towards a Medicare for all model, because Medicare is the one thing that has kept costs down. Costs have gone up much less quickly. You've seen the charts with the different graphs, right, than private insurance. And it gives government the leverage to try to restructure the system and make sure we get a lot higher value. And without that, you can't do that. The insurance industry has no incentive whatsoever. They're just trying to get their piece of profit, and if it comes by not covering sick people, they're more than happy to do that. In fact, that's been their business model. And so we're in a situation where something highly unethical and immoral, taking away of freedom, could take place very quickly. The other thing we want to point out is that it's not just about that fourth leg, the Affordable Care Act. Paul Ryan has plans, the Speaker, to go after Medicaid and Medicare, make Medicaid a block grant to greatly reduce its value and pull out from the federal investment and responsibility, and then turn Medicare into a voucher that loses value over time and puts health insurance companies in the middle and their profits in the middle. So it's a fight actually over all three legs. And let me be clear, that first leg, employer-based coverage, is under threat because of cost. And so more and more cost is being shifted on to the employee and reducing their wages right now, and that's going to get worse as well. And so quite frankly, the whole stool is unstable, and what they're proposing will make that much worse and will throw off not only 30 million, it'll be worse if they do what they want to do to Medicaid, if they do what they want to do to Medicare.
So let's talk about possible solutions. What can we do in the coming weeks before the new administration takes control, and also in the first year or so of that administration when we see the legislative agenda on the other side?
The one advantage we have is that conservatives, I mean Donald Trump, congressional Republicans, literally misled the public about what is causing healthcare to be hard to afford and what they were going to do. They didn't run on cutting 30 million people off healthcare and then going after Medicaid and Medicare and rolling back the Great Society. And so a lot of Trump voters think their healthcare costs are going to come down, they're going to have more choice, and they're going to have higher quality plans, and it's the opposite. And so we need to make that case. We need to create a public backlash at the level of the Tea Party in order to prevent them from literally, what they're planning to do is do a repeal without a replacement with a 3-year effective date on Inauguration Day. And they're going to do it through a budget maneuver that they can do it with just 50% of the U.S. Senate to go around the filibuster. And so we need to try to stop them from doing that. But if they do it, we need to have such a public backlash that it really puts pressure on them as far as the replacement, because they're going to give themselves 3 years for a replacement, and as far as backing them off going after Medicare and Medicaid. And we know that they want to go after Social Security under George Bush, and they backed off fairly quickly early in his second term because of the level of public backlash. We need to do that again in order to protect the system, but in doing that, we need to also talk about the system that we want to build.
So public backlash means what?
There's going to be a lot of actions. The Citizen Action Facebook page and our website will have lots of actions. We want other groups and individuals to join us, and we will help them if they want to do things. There are weeks of action starting both weeks before Christmas are weeks of action, and then there need to be actions throughout January, because we're talking about the first votes occurring in mid-January. And so really there needs to be a very quick backlash, and we need to tell as many people as possible what the consequences of these votes are, because most of the American public is unaware of this, and even those people who voted for Donald Trump on health care are completely unaware of what the real consequences of his actions are going to be.
So specifically, an action would consist of?
Well, we are going to have some press conferences with major opinion leaders. We're going to have candlelight vigils, for example. We're going to have sessions where people are calling their members of Congress. And frankly, we even need to call people who we know are on our side. Like, we need Senator Tammy Baldwin to hear so much about this that she feels the wind at her back and is much bolder, right? And is willing to filibuster in the U.S. Senate, for example. And so we don't want to just talk to the handful of allegedly swing votes in the Senate that might change their vote. We need to make it clear that the public is appalled by what's being proposed. And by the way, we need your ideas as well. So if you want, we want to work with individuals, with groups that have great ideas about how to bring people out and how to express how bad this would be and how to get the word out to as many people as possible who, like us, believe that healthcare is not simply a profit center, not a form of business. It is a fundamental human right, and that you cannot live your life and have self-determination over your own life and have real freedom without access to health care for yourself and your family, no matter what. And that we need to, I think most people believe that, and therefore they're going to be appalled the more they understand what this is.
So that's both depressing and a little bit inspiring, that there are things that we can do. One thing I would like to ask people who watch this video to do is to go online and look at the websites of organizations like ours that are working on this issue right now. The Physicians for a National Health Program website is PNHP.org, and the Citizen Action website is?
CitizenActionWI.org. You can just Google Citizen Action Wisconsin. It's the first thing that comes up. Our Facebook page is very active, so you can go there and like our Facebook page, and also on our website we have a weekly podcast, so you can get updates there. But we will have events, but we welcome ideas from you, and particularly if you live in areas around the state, we're willing to work with you on setting up events. I mean, you can have 5 people to do a candlelight vigil, and it can get a big impact. And the other thing is we're looking for healthcare stories, both people who would lose their coverage, but also people who know people. So it's okay to say my niece or my nephew will lose their coverage. I don't know what they're going to do. So we need to gather as many compelling stories as possible and then get them out in the public.
Yes. So please do that, and please consider joining us as well.
Okay, great.
That's great.
Okay.